How about now?
Hello. Is it working now?
Now it's
Yeah, sometimes happens. I don't know why. It's this mysterious stuff.
I'm
Internet.
on the way. Maybe I'm using a Wi-Fi box which spreads the internet,
Right.
and it takes a little bit time. Maybe that was one of the reasons, but maybe other reasons. So how are you doing? Thank you for the time that you have given me to talk to you, first of all.
No, thank you for your interest, really. I was very sorry because these have been very hectic times for me these last couple of months. So sorry for the delay and so on.
No problem. We have enough time because we are already
sorry.
So
anyway, we are here. So
yeah.
Thank you so much. So when you want, we can start and you tell me.
Yes. I'd like to start with the questions I sent you. Maybe you had some.
Yeah, I've seen this morning.
Yeah. So yes, as I have to take the glasses. I'm sorry.
Yeah, no problem.
You are professor of biochemistry and molecular biology at the Complutense University of Madrid, member of the Spanish Royal Academy of Pharmacy, and member of the board of the director of the International Association of Cannabinoid Medicine. So my first question is, how and when did you start working in the field of medical cannabis? I think we have a freeze. Yes, we have a freeze. Hello? No, here you go. So you got the question, but we don't. It was away. I don't know why. You suddenly freezed. So may I repeat the question?
Can you
again?
Can you?
Yes.
Or not?
I start again.
Yeah, because I was not hearing you.
Okay. How and when did you start your work in the field of medical cannabis?
Yeah, I started to work with cannabinoids by more than 25 years ago, after my PhD postdoctoral age, when I came back to my Complutense University. At that time, I was working on lipid metabolism, specifically on how our body breaks down fatty acids to obtain energy. And at that time, endocannabinoids were starting to be discovered and characterized. And anandamide and 2-AG, the best characterized endocannabinoids in our body, are also lipid molecules. So I said, well, I have experience in lipid metabolism. These new lipids are being discovered. They are very attractive molecules because they are supposed to be the endogenous cannabinoid receptor ligands. So I said, well, why not giving it a try? And so my first approach to cannabis was not because of THC, it was because of endocannabinoids. And well, since then, I'm here. Yeah. Okay. The next question is, which is your main research area with medical cannabis and the cannabinoids? During these more than 25 years that I've been involved in cannabis research, I've been mostly focused on 3 different areas. First, cancer, try to understand how cannabinoid receptors control cancer cell proliferation, survival, metastasis, etc. Second, neuroprotection, try to understand how cannabinoid receptors can protect our neurons under situations of toxic stimuli, both in chronic neurodegeneration and in acute brain damage. And third, try to understand how cannabinoid receptors control the biology of neural progenitor cells, that is, the cells that generate the brain in embryonic development and postnatal development, and specifically on how cannabinoid receptors can modulate the formation of the brain cortex. Okay.
The third question is, how is your point of view to the expression that cannabis in general can heal all kind of diseases? I mean, you hear it very often, but if you go into the materia, it's a quite.
Well, I will start. Yeah, absolutely. I will start with a brief and clear answer. That is not true. First, because no one has shown so far that cannabis can cure or that cannabis can even attenuate the progression of a disease. So far, what it has been shown is that cannabis can palliate the symptoms associated to different diseases. So cannabis, as I said, cannabis doesn't cure, cannabis can mitigate the symptoms, and that is very important, of course, for patients suffering from very debilitating
the answers. Okay, go back again. So let me mute this. No. Okay, so we can try again to go.
Yeah.
If it breaks, I think we shall do it to a time after the weekend when I'm back in my office, or you can read the questions and make a video and send it to me, if that's possible for you. If it's anytime in the next days when you have time to do that.
Okay, if you want, I mean, we can go step by step. I mean, we already did 2.
Yes.
So
we have 6
total.
Okay.
We can go and try. I mean, once we are here after so long, I think it's maybe better.
Yes. So we were at the point with the second question. We were at the point where you say it's you can't generalize it, but it has help. It is supporting, and maybe we go on from there.
Yeah, we can start even if you want the whole question.
Okay.
So I'll give a brief and direct answer to that question. And I would say that is not true. First, because no one has shown so far that cannabis can cure or even can attenuate the progression of a disease. What it has been shown, and it's very important for many patients, is that cannabis can palliate the symptoms associated to different diseases, such as cancer, multiple sclerosis, pediatric epilepsies, many different forms of pain, etc. So cannabis is a good adjuvant for the palliative care of chronic disease patients to improve the general quality of life of many patients that are suffering a lot because of their debilitating diseases. That is extremely important, but we cannot say that cannabis is useful, and even less that cannabis can cure all kinds of disease, because biologically speaking, that makes no sense. We have no unique cure to all the diseases. Human pathology is very complex and heterogeneous, so it is absolutely out of anyone's mind to believe, to be so naive to believe that we can have a unique cure for all kinds of diseases. Cannabis has a good location, a good room in our pharmacopoeia. It should be, in my opinion, more widely used for chronic disease patients with very debilitating disease. Can be so limited to claim that cannabis can cure any disease.
Okay. Coming to the third question, how is your point of view to the we had that. Okay, in which areas your research put reliable results that can be backed up and proven for therapeutical treatments with cannabinoids?
So far, the work we have been doing in the lab for the last 25 years that is closer to human application is that related to cancer, and specifically to primary brain tumors called glioblastoma. We found more than 20 years ago that cannabinoids can inhibit the growth of glioblastoma cells, both in mice and in rats. And during these last years, there have been 3 pilot clinical studies, one in Spain, one in UK, and one in Australia, showing, or at least providing hints about the possibility that cannabinoids can decrease tumor growth in glioblastoma patients and maybe also improve the quality of life of those patients. So now there are 2 big trials that are close to a start, one in Spain and another one in UK. And we hope that after 3-4 years, when those trials are finalized, we would have a definite answer as to whether cannabinoids could be anti-tumoral compounds and used as adjuvant chemotherapy in glioblastoma patients. If that is achieved and we get directly to those patients with glioblastoma upon the research we have done in our lab during the last years, I think I would say to myself, well, Manuel, now you can retire.
That's nice. So, I mean, it's a long time. I mean, if you're looking back from the beginning of your work in Spain, where does you stand now? I mean, if you reflect what kind of abilities and potentials Turkey could take from the experiences you make, what would you give Turkey on the way that they have to go on their researches, and where should they start?
Well, on the one hand, I believe it's very important to boost, to support basic research, because that is the basement for subsequent clinical research. But most important, if you go directly to patients, I believe that there should be programs to help patients with chronic and debilitating diseases to take cannabinoids under medical prescription so they can improve their quality of life. There are already some well-established areas of cannabinoid action in patients, for instance, inhibition of pain, inhibition of nausea and vomiting in chemotherapy-treated cancer patients, improvement of appetite and improvement of metabolism in cachexia patients and patients with wasting syndrome. There are also, of course, some trials supporting that cannabidiol can be useful for children with pediatric epilepsies, with refractory epilepsies, etc. So there are well-established areas of cannabinoid action that now we could use to help patients with those very severe diseases. But I believe that we should not be happy just with that. And I think clinical research in new areas is very important. And in that respect, I will think on 2 different types of diseases. One, diseases that have a high incidence in which I believe that cannabinoids could be useful. For example, THC in sleep disturbances. I believe that is a very important area of research that I'm sure that will give positive results in the coming years. And for instance, another one is CBD in skin diseases, how CBD can improve healing and the healing of wounds, how CBD can